questions for the governor and the commissioner, and we need answers from the governor and the commissioner. Parents are still being delivered promises that cannot be kept by the schools. Parents right now are being told that they will be in stable pods as our teachers, and that is not true, especially for our high school teachers and our specialist teachers. Our high school teachers will still see 160 plus students. In Central Falls, high school classes had up to 40 children in one room. Even operating at a hybrid plan, that would put CF students in classrooms of 20 with their teachers, who would see all 150 plus of them a day. Our specialist teachers, our librarians, our art teachers, our PE teachers will see entire schools of children and interact with entire schools of children. That is not a stable pod. When the governor says to us that in order to have a barbecue, we need to choose 15 people in Rhode Island that we're willing to see for like the rest of eternity until COVID goes away and nobody else, why is that same metric not being used in our classrooms? Why are we fine with teachers seeing hundreds of school children each week and spreading germs from pod to pod and then telling parents that it's stable? I'm feeling nervous that Trump has decided that teachers are now essential workers. If you know what that means, you know that essential workers are exempt from quarantining after exposure to COVID. That means that if a teacher is in a pod of students that gets a COVID case, that teacher is not going to be asked to quarantine. It means that the school could decide to still have that teacher report to work and see students in other stable pods. These are not stable pods. We are lying to families by telling them that stable pods at school will keep their children safe. We are lying to families when we say that ventilation is going to be addressed. Superintendent Peters has promised that ventilation is being addressed in Providence. It would cost over $9 million for Providence Public Schools to make all of the repairs needed to bring their ventilation systems up to CDC guidelines. There is no way that Providence Public Schools is spending $9 million in the next 2 weeks to adequately ventilate their schools. Warwick has said that their classrooms do not have windows that can open. You can't put box fans that are being recommended by the governor in most classroom windows that I've been to in Rhode Island. Fans are not going to cut it when you don't even have a space to put them. CDC guidelines are recommending more stringent cleaning. Districts are having problems hiring enough janitorial staff to follow guidelines. We cannot fund a safe return to school. It's a lie to tell our parents that we can do so. Burrville is following Warwick's footsteps and admitting that it is logistically and financially irresponsible and impossible to return students to school buildings. We need our school committees across Rhode Island to step up and make that same case. If you are sitting on a school committee meeting and you hear plans that sound logistically and financially impossible, it is your responsibility to step up and tell your community so, and to vote for a return to distance learning. We cannot promise our families a safe return to school when we cannot fund it and we don't have school buildings to provide it.
So all of us here today are telling the governor that she needs to knock it off. That she needs to listen to us and not listen to parents that are based decisions on parents just saying they don't have any child care and ignoring all the safety aspects of it. I would like to invite the governor to send her kids in the Central Falls Public School District and see if it's safe for them, if she would allow it. Because if it's no for them, then it's no for us. This governor needs to step up. This state needs to step up and invest in our schools. Equitable funding for these schools. So that way these kids, they are entitled to an education. And kids are going to miss out. But the safest choice right now is distance learning. The blood is going to be on her hands if she opens these schools when we have cases going higher and higher with students, with children, with teachers, their families. And yet she wants all of us to knock it off, wear a mask, and follow the guidelines. But she's changing the guidelines for schools. Does that make any sense to any of you here? The governor really needs to rethink her decision and put the safety of all of her Rhode Islanders, as that's her number one priority as a governor, is to protect all of us, which clearly she is not doing. She is in it for the money. She does not care. She is not up for re-election, so she does not care at this point what happens with the state of Rhode Island. She's about improving her political career. So we need to continue to fight. I'm hoping this governor will come out after her press conference and address us and give us some answers, because that would show us, if she didn't, that she does not care about what we think about her Rhode Islanders. I'm sorry, it is very hot talking. We're asking this state to please consider a more safer way and step up and improve schools and give us the equitable funding, and do not send these children into school to watch people get sick and possibly die or be in hospitals. Thank you.
All right. Last Tuesday, the Rhode Island Department of Education had a board meeting, and at that board meeting on the agenda was an item to approve a six-figure budget to go toward Ingenuity Inc. to be the virtual learning academy that students in Providence opt into. The board heard from, I think, 3 public comments, one of whom was the PTU president, who spoke out against this Ingenuity Inc. contract. And they went ahead and passed it anyway, without further comment, without asking parents and families how they felt about Ingenuity Inc. running Providence Virtual Learning Academy. They just decided to say that it was okay. Rhode Island and Providence have taken the same exact stance with everything regarding the fall. We'll just tell families one thing and hope that it doesn't upset them when they find out what's actually true. On September 14th, Rhode Islanders are going to find that their students are not on buses running at 50% capacity, that their students are not in classrooms that are stable pods. Their teachers are eating lunch in the classrooms with them with no masks. It would be nice if many children in Rhode Island could eat outside, as many as the governor, I think, is hoping. I don't know if the governor has visited Central Falls lately, but students are not going to eat lunch outside. It's not going to be what happens. My 22 students will be inside the classroom with me, no masks. If that's not safe for our restaurants, why is it safe for our school children? If that's not safe for our barbecues outside, why is it safe for our school children? Even if we could eat outside, why is it 15 at a barbecue and 130 outside during a lunch period? It's not safe. The commissioner and governor are hearing concerns from families about mental health of students, and that's a serious issue. During any pandemic or large global newsworthy event such as a pandemic, you would expect that mental health would be in crisis. You would expect suicide rates to go up. You would expect domestic violence to go up. It is not the job of our schools to mitigate these negative mental health situations. It is the job of the state to step up and fund safe resources for our families in their homes. We cannot send kids back to unsafe school buildings in the name of mental health. We're not being honest with families about what school is even going to look like in the fall. They're not going to be returning to their classroom. In my 4th grade classroom, we wouldn't even be able to have a whole class read aloud on the rug. If you've ever been to a classroom, you know that whole class time in the meeting area is central to the mental health of the classroom. Without that, school is not school as we know it. And pretending like we can return in person to schools as we knew them in February is a lie that we're selling to families by not showing them what their classrooms actually look like right now. Raise a hand if you've actually seen the inside of a single classroom in Rhode Island right now. Does it look the same? Does it look like how it looked like in February? How are we going to return kids to 6 feet of distance in the classrooms that we had that had 22 kids. Even at half capacity, my classroom does not have space for kids to remain 3 to 6 feet apart. Share some words from a Central Falls public school teacher who unfortunately can't be here today because despite everyone thinking that we're on vacation, most Rhode Island school teachers are actually in PD right now. Jordana says, I didn't leave my house for 57 days. I wouldn't let my parents or my family come within 10 feet of my boys or I for 2 months. I missed celebrating my 40th birthday with my family in Italy. I canceled a weekend trip. I can't take the boys to trampoline parks or any other indoor activity they asked to do. I haven't been to a restaurant or a bar in almost 6 months. Some of these were my choices, others were beyond my control, but regardless, I have avoided potentially unsafe environments. I have done my part to be safe. I have been responsible. I have followed all of the governor's rules. I have helped to make our governor look good. I don't want to get sick. I don't want my children to get sick, and I don't want my family to get sick. Now 6 months later, she is asking me to jeopardize my health, my children's health, and the health of my family. She is asking me to do exactly what she has told me not to do since March. She is asking me to take a risk on myself and my children. She is putting me in a very unsafe situation. I work in Central Falls, and it has been made very clear that the community of Central Falls, a school district which the state controls, is not a priority. This past June, the Central Falls School District rallied at the State House for equitable funding. The rally was not only to ensure full funding for the school year 2021, but also to advocate for a more stable and secure funding long term. Today, August 24th, the Central Falls School District, the place that our governor is asking me to return to, still does not have a budget for basic educational needs. So how can our governor, our commissioner, our health director even consider allowing these schools to open? Our commissioner, our health director even consider allowing these schools to open? How can they expect that I trust that they have the safety of my students and all of the staff in Central Falls as a priority? They have done absolutely nothing to earn that trust. The governor, commissioner, and DOH sign off on plans, but there is no mention of how much these plans will cost. There is no box on the ride reopening template for how much each part of the plan will cost. This is purposeful. This is yet another way to deflect responsibility on school districts when they know, and even if they don't, that is an even bigger problem, when they know that districts do not have the financial means to execute and sustain these plans. According to Ed Research for Recovery, school spending cuts negatively affect students' educational outcomes, and apparently neutral budget choices often have disproportionate effects on traditionally underserved students. A series of research studies over the past decade show that increases in school spending positively affect student test scores and long-term earnings. Boosting per pupil spending by 10% reduces low-income children's chances of poverty in adulthood by about 6 percentage points. RIDE asked for this research, yet I am unsure as to why. The plans, the structure, the mandates, nothing the governor or RIDE has said coincides with this research. My guess is it didn't align with their narrative, so it became useless to them. This is the problem. Our governor and commissioners stand up on a podium week after week, insulting the intelligence of every person in this state. They have demonstrated their lack of respect for education. They have educators. They have no respect for parents. They have no respect for students. How does our governor and commissioner think that they deserve the trust of anyone, especially those in the field of education? On March 13th, you asked everyone to completely change their lives. Now you are asking the complete opposite, but only in the area that fits your political agenda. None of this is based on science or facts. This is based on your ego, your game, and your financial gain. We are not stupid, even though you treat us as such. Every precaution that I have taken over the past 6 months will be erased the moment my children or I step into a school building. I am very sorry, Governor. I do not trust anything you say. I do not trust that you have even considered my best interest, my children's best interest, my students' best interest. None of your actions have proved otherwise. What I do trust is the pattern and what you have effectively done, shown that no one's voice matters but your own, and your political agenda and financial gain is far more important than my life, my children's lives, and my students' lives. Thank you, Jordana.
The governor clearly doesn't have our best interests. The other day she was interviewed by Channel 10, and she said it's a possibility of having school districts sign a waiver. Does anybody here think that they should sign a waiver? A waiver to go to school in case you get sick so you cannot sue the school district or the state. No. We should not have to sign a waiver. We should not have to sign a waiver and not feel safe about going to school or going to work. The playbook. They came out with a playbook. All the symptoms are classified into 2 categories where it's probable cases and not probable cases. And if you have a fever and the child has to be home for 48 hours, the parents have to basically say they've been 48 hours free of no fever. They could still have COVID. Do you guys think that's safe for children to be going in and out of school with a playbook like that? No. Every symptom should be a probable case. The governor knows there's going to be outbreaks in schools. Clearly. She's hoping that Rhode Island is in Georgia, is in Florida, is in one of any of those states. For her to actually make a plan to have... In Florida and Georgia? Florida still has cases. In order for her to make a plan for an outbreak in schools, in 3 different scenarios of not even shutting down schools all the way, how safe does that make students and teachers and parents feel about really sending their kids to school? Does she really think that's safe if she has to come up with plans for that? It is not safe. We need to continue to fight. We need to continue to keep fighting harder every single day until this governor realizes that it is not safe and that we are saying no. We are not backing down. These are our lives. These are our children's lives. These are teachers' lives. All of our lives matter. We should not be putting our lives at risk to go to work or getting education. Let me clarify something and just let me say something. Education can always be taught, whether it's online or in school. But you get one life in this world, and you cannot recover if that life is lost. You cannot recover a life that is lost. But children can always get an education. Teachers can always be there to teach an education. But once you die, that's it. There's no coming back.
Warwick, the district that... Am I on? Yes. Okay. Warwick, the district that the governor has accused of throwing in the towel, did the hard work that I hope all of our school districts are doing in finding out exactly how much it would cost to reopen safely in September. And that number was around $15 million. $15 million to even have a single child return to a school building. Not all children, not a full in-person plan, even a limited in-person plan, which is what the governor is suggesting for Warwick, would cost the district $15 million. Do you know that the state is already suggesting for the fiscal year 21-22 for schools that we're already facing budget cuts? Does it feel right to me to send some of our kids back to school buildings with a $15 million price tag? And Warwick, when they looked at their numbers, and they haven't gotten any money from the governor yet, but when they predicted how much money they might get from the governor, they were still left with a $12 million budget. $12 million to make this plan happen, that they don't know where these dollars are coming from. $12 million. And that's with districts across Rhode Island facing budget cuts in the education department in the school years following this one. And that's at no guarantee that even if we open our school buildings in September, that we can stay there for any amount of time. Warwick could open school doors on September 14th, have a case on September 15th, and need to close school doors right after. That's $15 million that Rhode Islanders do not have down the drain for what? For one day of in-person learning? For like 45 kids in a school building? Not worth it. And Warwick stepped up and told the governor as much by voting at their school committee meeting to return to 100% distance learning, and they are not the only school district making the move to do so. It would be wise for Rhode Islanders to listen to the school committees. They are the people who have the budgets. They are the people who have seen the plans. We have been way more transparent with our school committees than we have been with our teachers and families. If our school committees do not think it's safe to return to school on September 14th, it definitely is not safe to return to school on September 14th. They have read more plans than the governor. They know the budget when obviously the governor does not, or she would not be asking Warwick to open their school doors on September 14th, facing a $12 million deficit. She would not be withholding funding from schools that they desperately need to open and operate this coming school year. It is not safe for our kids to return to school because our districts cannot even afford the plans that they spent 3 months writing to open their school doors in 2 weeks. Also, this mic is open if anyone else has something to say. Words of Ashley, who's our amazing other organizer over here. So Ashley says, this is not my words, I'm not a parent in CF. I'm a parent in the CF district and I strongly advocate for the district. We all know it's not safe to open up schools. The governor, RIDE, and the Rhode Island Department of Health want us to be COVID-free. The governor wants us to all knock it off and follow guidelines to keep cases low in Rhode Island. If schools reopen, that won't happen. Well, today I'm saying to the governor, knock it off, and you're going to listen to us. I'm saying it is what it is, and I don't know what to tell you, which are the governor's famous words. We want our concerns answered and met. Lives over lessons first, Gov. All districts need equitable funding, and the state needs to stop underfunding school districts like they do year after year. Mostly all school buildings in Rhode Island need improvements. One of the main safety concerns is the ventilation and air quality in schools. Without it, it puts teachers and students at risk. Good airflow and ventilation help reduce the transmission of viruses and bacteria in the air. Does anyone here agree with the governor's plan to do alternative things in place of not updating school ventilation systems? And does anyone agree with her saying ventilation and air quality should not be a concern? Hell no. No, the state needs to invest in our schools and make the improvements needed. The money that she wants schools to use to temporarily fix things can be used in other and more effective ways for schools, and the state still needs to give the funding to schools. The governor claims masks are the key to not getting this virus. Masks do not stop you from getting the virus. If you have a cloth face mask or a surgical mask, you can still get the virus, especially with it being airborne. 100 per 100,000 cases is a very high number for a small state like Rhode Island, especially in communities like CF, Pawtucket, Providence. It should be much less than that. Oh, Pawtucket's the other urban district I forgot to mention. It should be much less than that. Experts have said even 40 per 100,000 cases is high. That's absolutely true. Anita Cicero, who is the Deputy Director of Health Security at Johns Hopkins, has said that it would be not responsible to open schools with even 40 cases per 100,000 people, which is less than half of what the governor and Dr. Alexander are suggesting. Experts have said that even 40 per 100,000 cases is too high. The state needs to use a more effective and strategic metric other than just following the White House guidelines. The governor is pushing outdoor classes in tents, which is not safe for many reasons. I would like the governor to stand outside for 6 hours in a tent in the wintertime, or have her children be in a tent in the winter for 6 hours in a public school setting such as Central Falls. Not a problem, because your children will be safe and sound at LaSalle. We know the answer is going to be no. So if it is a no for you, then it's a no for all of us too. The governor says that the intellectual harm and the mental health and social emotional needs are a greater risk than COVID. Do you all agree with the governor that mental health should take precedent over physical safety? No. The governor says that if her kids get sick, she is not worried. That's probably the luxury of having great health care. Of course she would say that. Private schools have better safety measures in place than public schools. The governor has to set an example by saying she is sending her kids to school, but we all know that she wouldn't be if she thought her kids were going to be exposed. The governor is changing safety guidelines as she goes along to fit her agenda with opening up schools. Instead of making them strict, they are making them less strict. If the governor is saying that it's 19 times more likely that you will get the virus indoors than outdoors, why is she still pushing us to open schools, knowing that there are a lot of risk factors in doing so? It makes no sense that the governor doesn't want more cases to go up, telling us to follow guidelines, no more fatalities, but is still insisting on schools reopening. The governor also stated that waivers could be a possibility. Does anyone here want to sign a waiver to go back to school? Does it make any sense to anybody here that we will not move into phase 4 and outdoor gatherings are still at 15, but it's okay to have 30 or more people in the classroom? No. The governor needs to put all Rhode Islanders' safety first. It doesn't make sense that the governor knows people will get sick and there will be outbreaks and just says, well, I have a plan for that. There shouldn't be a plan for that, especially since it's avoidable. By the time that there's a plan, it will be too late. Again, we know very little about how this virus affects kids, but Dr. Fauci has stated that children are experiencing neurological disorders from COVID. There are long-term side effects that people experience after having COVID, per Dr. Fauci, which is called the post-virus syndrome. People with underlying health conditions, people over the age of 50, those are the age of 50 living with families. It's a high risk. The playbook that the state wants schools to follow should have every symptom a probable cause, not classifying what symptoms are probable and what symptoms are not. Again, we are not here saying we don't want in-person learning. Parents and teachers want nothing more than to return to the classrooms and to send their children to school. It is not safe enough at this time to do so. Like I said in the last rally, it only takes one to pass the virus, and it's a domino effect after that, and one death is too many deaths. The governor and commissioners should not be basing their decisions off of parents sending emails saying they have to work and they need schools to open, and risking our lives and ignoring the safety aspect of it. What about the thousands of parents and educators sending emails saying it's not safe to open? Not one of them has been addressed. What about the teachers who need to work and are parents? This is a fact that if schools open, what are those parents going to do when their children get sick or have to quarantine for 2 weeks or more? Or the fact that the school will still go to full distance learning. This is why the state should help and come up with a plan for that. We are not out of this pandemic and won't be for a while. I'm asking the governor of this state, school committee members, and superintendents to please consider distance learning for the start of the school year, especially in our most vulnerable cities that are affected the most. Distance learning is not the solution, but it's the safest choice, and the state needs to look at what is the safest choice. I'm asking them to make the improvements to schools and to provide the equitable funding. Also to improve distance learning so students and teachers can engage effectively, and to help the many that struggled with distance learning. I'm hoping the state will give all of us a safe return to school. Lives over lessons first. Thank you. Rhode Island, I have made my voice heard loud and clear for the past month. We've been out here asking the governor and the commissioner to listen to us, and it is clear that the governor and the commissioner will not listen to me, will not listen to you. And it's really important in this moment to ask your union leaders and your school committee members to step up and take up this fight. It is not fair to put the burden of this fight on the shoulders of our teachers and parents who are facing challenges unprecedented in any other school year this coming school year. In 2 weeks, our teachers and students are being asked to return to, they don't even know yet. And it is unfair to leave this fight on their shoulders. You must demand that your union leaders and school committee representatives step up and make their voices heard. The governor and commissioner are not going to listen to me. It doesn't matter if I stand out here every day. It doesn't matter if I had 50-foot tall speakers. They do not care what I have to say. And it is our job to make sure that the people whose job it is to say things that the governor needs to hear, that they use their voices to speak up. When my school committee members showed up at our last rally, it was the first time they had heard that the city that they represent had a 10% test positive rate. Yeah, August 14th. First time that my school committee leaders had been aware that East Providence had a 10%, East Providence, did I just call them out by name? I didn't mean to. Sorry, Mr. Ferreira. But it is your job. And I had to kindly tell him that I had known about this since we started this fight on July 27th. East Providence is bringing to a vote this week distance learning. You know why? Because I pressed him until he saw that it was important. Standing out here isn't enough. You need to attend your school committee meetings. You need to text your school committee members. You need to take to task the people whose job it is to have this fight, because it is not my job. I'll do it. I'm happy to do it. I don't want to go back to school, and I'm happy to sit here and fight, but it's not my job, so no one's going to listen to me. No one's going to hear you. We need our union leaders and our school committee representatives to step up and fight for us to not return to school. If they don't know the data, and I wouldn't assume that your school committee members know the data, if they don't know the data, show them the data. There is not one county in Rhode Island, not a single county, not one. Not even South County, not East Greenwich where Mr. DePietro lives. There is not one county that the Harvard Global Health Institute has named as safe to reopen schools for in-person learning in any capacity. Any capacity. That's the Harvard Global Health Institute. I don't know why Gina and the commissioner feel it's appropriate to ignore them when they've told us that they're going to step up and make us have a safe return to school that follows data and science. Why are they ignoring the Harvard Global Health Institute just because it disagrees with Dr. Fauci? Why isn't Rhode Island questioning why people are disagreeing with Dr. Fauci? Why are we fine with just taking his word? Why is the governor fine with him going on air and telling all of Rhode Island that Rhode Island is green and good to go when Central Falls still has an over 20% test positive rate? We need people to step up and make their voices heard. We know that the governor and commissioner are hearing from families that want to go back to school. We need to make sure that they're hearing from all of us. We need to email. We need to talk to our school committee members. We need to make public comment at our school committee meetings. You need to know when your school committee meetings are. You need to show up, and you need to make sure that your school committee members hear you and hear what you want and put it on the agenda and bring it to a vote. We cannot wait for the governor any longer. It's clear that she's not going to budge. It's clear she doesn't care what we have to say. It's important that we start with our school committees and move up through our elected officials until we're heard by the governor and until she hears and acknowledges the numbers. Rhode Island is not ready to reopen schools. If Dr. Fauci says it's fine and he's going with the least stringent metrics, why is that fine with us? When it comes to the health and safety of our students and teachers, why are we fine with going with the least stringent metrics for safety? Why 100 cases per 100,000 when states like Oregon have opted for 10? 10 cases per 100,000 if you live in Oregon. How is it okay that Rhode Island chooses 100 and is mad that teachers and parents are asking why? Right? Gina loves to call us fearmongers because she doesn't want us to tell you that 100 cases per 100,000 is far too many. But I'm not the only person saying that. It's not just me. Anita Cicero from Johns Hopkins, their Deputy Director of Health Security, has said as much. She has said that it would be not responsible to open with 100, 75, 60, even 40 cases per 100,000 people would not be safe. And Gina and Dr. Alexander Scott feel like it's fine to tell us that in Rhode Island we're just so special here, that 100 cases is the number that they somehow magically arrived at for us, and we're just supposed to trust them. I'm not fine with 100 cases per 100,000. I'm not fine with the least stringent safety metrics for reopening schools in the country. People love to talk all the time about how schools in Europe open safely. There's been studies done that a lot of the schools that open safely in Europe had between 1 and 20 cases per 100,000 people. Rhode Island isn't there. Rhode Island is not ready to reopen schools on September 14th, and it's a lie for the commissioner and the governor to keep trying to convince people that it is. Their whole argument resides in this number 100 per 100,000 cases. Their whole argument resides in the White House COVID task force metrics of safety, and those have again and again been disagreed with. Do you see this representative? Look at him. He's running for office over there, and he's waving at everybody like he agrees when he was out here 2 seconds ago being like, put kids back in school, and now he's waving at our car rally like he agrees with them. For shame. For shame. You cannot be in this argument on both sides. That's complete BS. How are you going to send kids back to school and have distance learning? That's bullshit. Rhode Island, thank you so much for coming out today. Please make sure you go to your school committee meetings. You can find listings for every school committee meeting in the state at www.tinyurl.com/Rhode Island-school-meetings. And even though Mr. DePietro thinks that I have taken the summer off, actually I've been inputting this data one by one, district at a time, by myself, on my own free time. So show up to your school committee meetings, please, and tell your friends to join you. Thank you.